Feeling like you can't shed those extra pounds no matter how hard you try? You might be dealing with a hidden culprit, fatty liver disease. Stick around, because today we're diving into how this condition affects your weight and what you can do to turn it around. What is fatty liver disease? Welcome back to the channel. Today, we're unpacking fatty liver disease, a condition that's becoming increasingly common. But what exactly is it? Fatty liver disease occurs when excess fat builds up in liver cells. While it can be caused by alcohol consumption, the more common type is non-alcoholic fatty liver disease, or NAFLD. This condition can lead to inflammation and scarring, significantly impacting your metabolism and, yes, your ability to lose weight. What are the causes of fatty liver disease? There are several risk factors to consider. Obesity. Being overweight or obese is the primary risk factor for fatty liver disease. Excess body fat, especially around the abdomen, can lead to inflammation and fat accumulation in the liver. Studies show that even a modest weight gain can increase the risk significantly. Diabetes and insulin resistance. Conditions like type 2 diabetes and insulin resistance are closely linked to fatty liver. When your body becomes resistant to insulin, it struggles to process glucose effectively. This can cause higher levels of insulin in the blood, which promotes fat storage in the liver. High cholesterol and triglycerides. Elevated levels of cholesterol and triglycerides in the blood can contribute to fat buildup in the liver. These lipids are transported to the liver, and when the liver becomes overwhelmed, it starts storing excess fat, leading to fatty liver disease. Poor diet. Diets high in refined carbohydrates, added sugars, and unhealthy fats are major culprits. Consuming too many sugary drinks, processed snacks, and fried foods can lead to fat accumulation in the liver. Studies indicate that a diet rich in fruits, vegetables, whole grains, and lean proteins can help protect against fatty liver. Sedentary lifestyle. Not getting enough physical activity increases your risk of developing fatty liver. Regular exercise helps regulate body weight, improves insulin sensitivity, and lowers fat levels in the liver. A sedentary lifestyle can contribute to obesity and other metabolic conditions, compounding the problem. Certain medications. Some medications can also lead to fatty liver disease. Common culprits include corticosteroids, certain cancer treatments, and medications for HIV and high cholesterol. If you're on medication and concerned about your liver health, consult with your healthcare provider. Understanding these risk factors is essential for prevention and early intervention. Let's dive deeper into the signs and symptoms next. Signs and symptoms of fatty liver disease. Now, you might be wondering, how do I know if I have fatty liver disease? Many people experience no symptoms at all, especially in the early stages. However, some common signs can indicate the presence of the condition. Let's take a closer look at these symptoms. Fatigue. A general feeling of fatigue is often reported. This isn't just normal tiredness. It can be a persistent lack of energy that interferes with daily activities. The liver's role in metabolism and detoxification means that when it's not functioning properly, your energy levels can plummet. Weight gain. Unexpected weight gain, particularly around the abdomen, can be a red flag. This can occur due to fat accumulation in the liver and may also be linked to metabolic changes associated with insulin resistance. Even if you're eating a balanced diet, you might notice stubborn weight around your midsection. Abdominal discomfort. Some may experience pain or discomfort in the upper right abdomen where the liver is located. This discomfort can vary from a dull ache to more significant pain, and it might be worse after eating a fatty meal. It's essential to pay attention to these sensations, as they can indicate inflammation or stress on the liver. Elevated liver enzymes. Blood tests may reveal elevated liver enzymes, indicating liver stress. Common enzymes measured include AST, aspartate aminotransferase, and ALT, alanine aminotransferase. Elevated levels can signal that your liver is inflamed or damaged, often prompting further testing or evaluation. Jaundice. In severe cases, yellowing of the skin and eyes can occur, a condition known as jaundice. This happens when the liver is unable to effectively process bilirubin, a byproduct of red blood cell breakdown. Jaundice is a sign that the liver is significantly impaired and requires immediate medical attention. If you think you might be experiencing any of these symptoms, it's crucial to consult a healthcare professional for a proper diagnosis. Early detection can lead to better management and treatment. Now that we've covered the symptoms, let's dive deeper into how fatty liver disease is connected to weight gain and what that means for your overall health. The link between fatty liver and weight gain. So, how does fatty liver disease contribute to weight gain? Well, when your liver isn't functioning optimally, it struggles to process fats and sugars effectively. This can lead to increased fat storage in the body, making it harder to lose weight. Additionally, insulin resistance often accompanies fatty liver, which can further complicate weight management. Basically, a fatty liver can create a cycle of weight gain that's tough to break. Prevention and management strategies. Now for the good news, there are effective ways to prevent and manage fatty liver disease. Here are some key strategies you can implement. Adopt a balanced diet. Focus on whole foods. Think fresh fruits, vegetables, lean proteins, and whole grains. A diet rich in antioxidants, fiber, and healthy fats can help support liver health. Here are some specific tips. Increase fiber intake. Foods like beans, lentils, oats, and whole grains help regulate blood sugar and cholesterol levels. Choose healthy fats. Opt for sources of healthy fats, such as avocados, nuts, seeds, and olive oil, while limiting saturated and trans fats found in processed foods. Limit sugary foods and beverages. High sugar intake can lead to fat buildup in the liver. Replace sugary drinks with water or herbal teas and choose fresh fruit for dessert. Stay active. Aim for at least 150 minutes of moderate exercise each week. Regular physical activity is crucial for maintaining a healthy weight and improving liver function. Incorporate different activities. Mix cardio exercises like walking, swimming, or cycling with strength training to build muscle and increase metabolism. Stay consistent. Find activities you enjoy to make exercise a regular part of your routine. Even small changes like taking the stairs or going for short walks can add up over time. Maintain a healthy weight. If you're overweight, losing even a small percentage of your body weight, around 5 to 10%, can help reduce liver fat significantly. Here are some ways to achieve this. Set realistic goals. Aim for gradual weight loss through sustainable lifestyle changes rather than quick fixes or fad diets. Track your progress. Keeping a food diary or using apps can help you stay accountable and aware of your eating habits. Limit alcohol consumption. If you have fatty liver disease, it's best to avoid alcohol altogether to prevent further liver damage. Alcohol can exacerbate liver inflammation and fat accumulation. Educate yourself. Understand the impact of alcohol on liver health and seek support if needed. Seek alternatives. If you enjoy social settings, explore non-alcoholic beverages or mocktails to still participate without risking your liver health. Regular checkups. Finally, regular health checkups are essential. Monitoring your liver health can help catch any issues early. Schedule routine blood tests. These can assess liver function and check for elevated liver enzymes. Discuss risks with your doctor. If you have risk factors for fatty liver, proactive discussions with your healthcare provider can guide appropriate screening and management. Implementing these strategies can significantly impact your liver health and overall well-being. Remember, it's about making small, sustainable changes that lead to lasting results. The liver is called a silent organ. It doesn't have nerve inside, therefore it can run without pain, even though it is damaged at a certain level. So going to check with doctors regularly is very important. Also, the liver is generally very strong and can come back to normal if you notice what is wrong in the early stages and change your behavior related to your food intake and exercise strategies. There you have it. Fatty liver disease can complicate weight management, but with the right lifestyle changes, you can prevent and even reverse the condition. If you found this video helpful, please give it a thumbs up and share it with someone who might benefit. Don't forget to subscribe for more health tips and insights. Until next time, take care of your liver, and it will take care of you.